Hello viewers, in this video we will discuss about jaundice, its types, symptoms, diagnosis, and its treatment. So let's start the topic. Jaundice is a medical condition characterized by yellowing of skin, eyes, and mucous membrane, due to elevated levels of bilirubins in the blood. What is bilirubin? It is a yellow pigment, formed by the breakdown of red blood cells in the liver. Types of jaundice. These are, number first, pre-hemolytic jaundice. It is also called hemolytic jaundice, which occurs due to excessive breakdown of red blood cells in liver. Causes of pre-hepatic jaundice. Hemolytic anemia, for example, sickle cell anemia, glucose 6-phosphate dehydrogenase deficiency. Infections, for example, malaria, sepsis, autoimmune hemolytic anemia. Drugs and toxins, transfusion reactions, due to mismatched blood. Second type of jaundice is hepatic jaundice, also known as intrahepatic jaundice, which occurs due to damage or dysfunction within the liver itself. Its causes are infectious hepatitis, such that hepatitis ABC, alcoholic liver disease, non-alcoholic fatty liver disease, cirrhosis, liver cancer or metastasis, drug-induced liver injury, such that paracetamol, autoimmune hepatitis, genetic or metabolic disorder, for example, Wilson disease. Third type of jaundice is post-hepatic jaundice, also called obstructive jaundice, occurs when there is a blockage in the bile ducts. Its causes are gallstones, which blocks the bile duct, tumors, such that pancreatic cancer, biliary strictures, narrowing of bile ducts, primary sclerosing cholangitis, parasitic infections, for example, liver flux. Symptoms of jaundice are yellowing of eyes and skin, dark urine, pale stools, fatigue, itching, abdominal pain, mainly in right upper quadrant. Diagnosis of jaundice. Blood tests, such that bilirubin test, liver function test, ultrasound, CT scan, MRI, liver biopsy. Treatment of jaundice. Its treatment depends on underlying the cause. Firstly, treatment of pre-hepatic jaundice. These are treating the cause, for example, malaria, autoimmune hemolysis. Folic acid supplements. These are used for supporting red blood cells production. Avoid trigger in conditions like G6PD deficiency. Blood transfusion, if the case is severe. Steroids or immunosuppressants. Treatment of hepatic jaundice. These are use of antiviral for hepatitis B or C. Use of corticosteroids for autoimmune hepatitis. Lifestyle changes, for example, alcohol cessation, weight loss. Stop hepatotoxic drugs, nutritional support, for example, use of vitamin K, and proteins control. Treatment of post-hepatic jaundice. These are use of endoscopic procedure for stone removal, stent placement, sphincterotomy. Surgical intervention, such that cholecystectomy, tumor resection, percutaneous transhepatic cholangiography, such that drainage or stent placement through the skin. So, dears, that's all about jaundice. Thanks for watching.